Learning the rules, the opening. Every skill starts the same way. A presentation brought to you by 4YourCNA.com. In this lesson, we will learn about the opening. You may have noticed that all skills start with the opening and end with the closing, so that is where we will start. The opening is our first piece in every skill. The opening is a very specific set of tasks that must be performed at the beginning of each skill. These tasks must be done in a certain order. Let's look at each step a little closer. Every skill begins with a knock on the patient's door. Think about this from the patient's point of view. Patients are in an unfamiliar place full of strangers. Sick patients need rest. But every time they close their eyes, some new stranger enters the room, often with no warning. Imagine opening your eyes to see a complete stranger standing over you. How well do you think the patient is going to be able to rest? How well would you sleep knowing that some stranger could come in at any minute? Knocking every time you enter the room ensures that the patient's privacy is maintained and allows them to rest more comfortably between caregiving tasks. Think of it this way. Patients are paying for that room. When you rent a hotel room, you expect that the employees of the hotel will knock before entering. They may be coming in to perform a service that will benefit you, like bringing fresh towels. But you still expect them to knock first, even though you are in their hotel. Patients should receive the same courtesy. Don't look at patients like they are in your facility. Instead, remember that you are in their room. Knocking shows that you respect these boundaries. Every encounter must begin with a knock, even if you just left the room. After you knock and enter the room, you will address the resident by name. Most patients have the ability to self-identify or respond to their name. If a patient cannot respond to their own name, the care plan will tell you how to identify that patient. For the exam, the patient will not have an ID band. You will simply address them by name. For the exam, a simple name, such as Mr. or Mrs. Jones, will be used for all patients. You are graded on addressing the patient by name for every skill. After you identify the patient, you will introduce yourself by name and title. Think of all the people in and out of the patient's room every day. There are multiple doctors, several nurses on each shift, CNAs, plus billing clerks, dietary aides, transporters, phlebotomists, EKG techs, and more. You cannot expect your patient to remember you in this sea of strangers. You must introduce yourself by name and title every time you enter the room. After introducing yourself, you will describe the skill that you are there to do. Explain the skill to the patient in a way that they will understand. Will you be brushing their teeth, making their bed, helping them get dressed? Then obtain permission. This is as simple as asking, "Is that okay?" Patients have the right to refuse any and all care at any time. CNAs are never allowed to touch a patient without their permission, ever. If the patient refuses, CNAs must notify the RN of the patient's refusal. But for the exam, the person playing the patient will be cooperative and say yes. After getting consent, close the privacy curtain. The curtain is not clean. Think of all the hands that touch that curtain. Patients, visitors, staff members all touch that curtain with unclean hands. That curtain has every body fluid imaginable on it. Patients cough, sneeze, and throw up near that curtain. They scratch what itches and then touch the curtain to open it. Staff members change bandages, empty urine containers, and clean up soiled residents, often opening the curtain with those soiled gloves without even thinking about it. Since that curtain is not clean, you should always wash your hands after touching it. That way you start the skill with clean hands. After closing the privacy curtain, wash your hands. You can't touch clean supplies with dirty hands. Finally, gather your clean supplies to start the skill. So the entire opening should sound like this. Hi, Mr. Jones. My name is Patty, and I'm your CNA today. I'm here to do mouth care. Is that okay?
Yes, that's fine.
Okay, I'm going to close your privacy curtain and wash my hands. I'll be right back. The opening is done at the beginning of every skill that you will do. Practice it often, and you'll never forget how to start a skill.